Now then, how would you feel if you were about to undergo an operation in a hospital and a nurse offered to pray for you?
Well, that's what Sister Sarah Coutard did for her patients, and it led to her being sacked. She says she's being punished for being a Christian, but did she overstep the mark? She joins us now alongside broadcaster and commentator Nick Ferrari. Welcome, both. So thank you very much indeed for coming in. So, practising Christian your whole life, came to the UK from Sierra Leone in 1993, been a nurse for 15 years. When did you first know that there was a problem? When did they say to you, we're not happy with what you're doing?
Oh, that was in April this year.
Right.
April this year.
And what did they say?
My manager called me into the office, and it was a very casual, less than 2 minutes call, chat, sat on the desk and said to me that there had been complaints from patients regarding me, talking about my religion at work.
And when do you think, if you looked back at that, when do you think you talked about your religion with the patients?
Oh, I did right from the very first time I started assessing the patient based on the questionnaire that I had to go through with the patients.
So this questionnaire, this is because you were assessing patients' health before they underwent a surgery, and part of the job was to help them fill out the questionnaire where they would ask you whether or not you had a faith, what your religion was. So the question would come up if somebody didn't tick the box, or if somebody ticked the box of them being a Christian. Then what sort of conversation would you have with them, for example?
It's not a tick box, it's they're supposed to write.
Right,
So
okay.
if they didn't write, while I'm going through the questionnaire, if they didn't write, I said, oh, what religion are you? They would either state it, and I'd write it down, or say, I'm not religious or anything. Or they'll write Roman Catholic, whatever religion they were, they'd indicate it then.
So what would sort of conversation would come off the back, say, if they said, oh, I have no faith, I'm not religious? What would you say to them?
I could say, oh, why not? I have asked, although not all patients, I have asked why not, and someone could say, well, I'm not religious. I'm probably, you know, I'm heading for hell anyway. I'm not a good person. I know, and it could.
But if you said that
things
to me, if I'd ticked that box and said that I'm not religious, and you said why not, I would then say, that's none of your business, because I'm here to be treated for an illness of some sort. My religion, I've already stated that I'm not religious, so I don't need you to take it any further.
Absolutely. It shouldn't go any more than that at all.
And did you ever think you went any further than that?
No.
And so as far as your disciplinary hearing is concerned, do you think that it was fair that you were, first of all, called in, and secondly, sacked?
It wasn't fair that I was sacked, but it was just that I was called in. Because if your manager has had complaint about it and she called you in, it's good that she called me in and alerted me to it. So that was fair. But that I was sacked, that was not fair.
It looks though, when you read the case, and please, obviously, feel free to correct me on any of these points, but it looks as if you were asked to stop, and then you didn't, and you continued. And then even when you ended up in that disciplinary hearing, you said, you know, I'd actually find it really difficult to stop. I'd find it hard. It looks like you just couldn't stop.
How could you treat any patient thinking how holistically we've got to care for our patients, just looking at their physical needs and not looking at the psychosocial and spiritual needs? It's difficult to actually...
But it depends if their spiritual needs are the same as yours. I mean, you could behave in a Christianly manner and act like a Christian without talking about being a Christian, especially if somebody didn't necessarily want that.
Yeah, but I wasn't talking to people who didn't necessarily want it. I wouldn't go any further.
Yeah.
Well, during the investigation, one patient said that you gave her a Bible and she didn't want that, and that you said you would pray for her. Another said that she felt uncomfortable that you were preaching at her. And so, I mean, the other thing also for me, and Nick, I mean, if I was in hospital, and you know, regardless of whether I was or wasn't a religious person, you know, and someone said as I went down to the operating theatre, I'm not saying this is when you did it, but you know, I'll pray for you. I mean, it would frighten the life out of me.
I think all this young lady is guilty of is caring too much. I think what is appalling for her now is that, did she overstep the mark? Maybe a little. I hear what you say, but I really, really do. But we have now lost her a woman of this level of experience is lost to the nursing profession, it's going to be very difficult for her to find work, because I'm sure, as you're aware, in something such as medicine, if you've got a blot on your employment record, it's damned hard to get a job. So why is this? Last time I looked, we are living in a Christian country. People say, when I drop relatives off at church, I say a prayer for me. It's quite a light-hearted thing. It was 2 weeks ago, it was just a couple of weeks ago, that the Prime Minister said people should not be afraid to show that they're Christians in their workplace. Did this kid go a level too far? Maybe that much. Does she deserve to lose her job? And listen to one of the words. I don't blame you, by the way. You're just being a journalist. An investigation was held. What's she doing? Trying to blow the hospital up?
I guess, Nick, the only thing
that
what would you think about this point is that I guess when somebody's in hospital, they possibly may be feeling at their most vulnerable. I mean, it may be in other workplace, other environments, of course, speak freely, say what you like, but maybe because that person may have felt slightly preached to when they didn't want to, when maybe they were feeling more vulnerable than normal because they were in a place where they were being cared for and they hadn't possibly had whatever their treatment was. But they're at their most vulnerable.
They are.
So did they need that at that point?
But isn't that when you need committed people like this girl here?
You can be committed without necessarily handing somebody a Bible.
I agree, and I hear you. And the fact that, Sarah, you know, you were asked once before and you weren't, that was an issue. But I think the fact that you now are finding it damn difficult to get work in a profession that you love, where we are crying out for people with your level of dedication, skill, compassion and care, and you just let your Christianity trip over that much, I think it is wholly wrong. I think the hospital is actually...
I absolutely agree. I agree with every point of that, but it's not letting your Christianity just trip you over. It's like being told not to do something and then continuing to do it, making patients feel uncomfortable.
But she's doing it because she believes that she's helping the patient.
Absolutely, but obviously some of those patients didn't feel like they were being helped.
Well, the thing is, though, you've got to look at things in the proportion in which I did it. I cared up to over 1,000 patients, and where few of them have come and complained about me talking about my faith. And you've got to bear in mind, they didn't really... This is all second-hand complaints. From
so
patients
no one
to my
said
colleague.
anything to you? They just went off and complained officially, but they didn't say to you, please don't do that?
Not to me directly.
Because had they done that, just tell them what would you...
Had they done that, in fact, when the girl got out, I was quite pleased. I had that chat with her. Had they done that, I would have reviewed what I'll do next time.
And if you could now go back, say, to 2 weeks ago and changed your behaviour in any way, would you do anything differently?
What would I do differently? This is a question I have often asked. And it's all, at the end of the day, boils down to the patient you are talking to at the time and what it's related to them at that particular time. It's difficult to really say what I could do differently.
So I have to ask you then, in that case, would you do the same?
I would not... what would I say? Would I do the same thing? What do you mean by the same?
The thing that got you sacked.
The thing that got me sacked is I could not convince anyone that I would not talk about Jesus Christ, or I would not comfort my patients.
But
I would not...
Without leading the witness, but if somebody said, I'm interested, sister, I don't want to hear about that, what would you do then?
Oh, I certainly would just stop.
Okay.
All right.
Look, thank you very much for coming.
Thank you very much indeed.
And
obviously, as Nick quite rightly says there, an enormous amount of skill and compassion going to waste.
You're obviously a very good
which is a great
person
shame.
as well.
Thank you.
That's clear to all of us. Thank you.